Here today and being part of this very important program for Metropolis CSR initiative. We are here today to commensurate the Metropolis, the MedEngagement Scholarship Summit Program 2024. So this is a flagship CSR initiative for the company. We have been running this over the last 5 years, started from 2018-19 onwards, and here the program basically covers financially supporting very needy and very high talented professionals who are pursuing their MBBS and other medical aspirations, and we support them on financial needs and also on research and the other areas of their career progression. So this year we have actually selected about 301 students across the country. I mean, this goes through a very cumbersome process of first the student themselves coming and applying for this scholarship program, and then on the basis of merit and of course needy students and professional agency called Deloitte actually conduct the thorough screening and processing of the candidature of the people who apply. So out of this year, for example, out of 6,000 students who applied for the program, 301 students have come at the top list of students, and we have selected them, and the company commits about roughly 2 crore of rupees annually for this program. And this year 301 students have been eligible, of which 60% of them are women students, basically the girl students, and which talks about our focus on the gender diversity as well. So we are firmly committed to the building of the healthcare ecosystem in the country for the future, and supporting the healthcare healthcare students and pursuing their career studies in the future. So that's what this whole program is about. And I hope you know Metropolis Healthcare Limited is a company who is in existence for the last 40 years in India, and we operate almost across the country, right? We have diagnostic labs. We have close to 200 labs across the country, and about 4,000 collection centers, and about 500 home visit executives who comes in whenever you need a blood test to be done or any testing to be done about the human body part, right? You can use the services of Metropolis Limited, and we operate in about 600 towns across the country. That's about Metropolis. And in Tamil Nadu, we are having 21 labs and 350 collection centers, which are the blood collection centers, and about 125 home visit executives that we have in this state. So Tamil Nadu is a big market for us, and we are committed to serving the people of Tamil Nadu on the diagnostic services, right? And also, like I said, we have a huge commitment to the corporate social responsibility through the MedEngagement program and many other programs that we have. Thank you.
The MedEngagement சம்மிட்டுக்கு வந்த எல்லாருக்கும் வணக்கம். இந்த MedEngagement சம்மிட் ஒரு CSR ஆக்டிவிட்டி மெட்ரோபாலிஸ் ஹெல்த் கேரோட. இந்த CSR ஆக்டிவிட்டி மூலமாக நம்ம பட்டிங் டேலண்ட், அதாவது மெடிக்கல் ஃபெட்டர்னிட்டியில் ஃபஸ்ட் இயர்லேருந்து ஃபைனல் இயர் ஸ்டூடெண்ட்ஸ் வரைக்கும் MBBSஆக இருக்கட்டும், இல்லை அவங்க பண்ணுற ஹையர் ஸ்டடீஸாக இருக்கட்டும், PG ஸ்டூடெண்ட்ஸாக இருக்கட்டும், அவங்களோட ஸ்டடீஸ்க்கு உதவுற மாதிரி நம்ம ஸ்காலர்ஷிப் கொடுக்குறோம். அதை செலக்ட் பண்ணுறதுக்கு ஒரு மெத்தடாலஜி வச்சுருக்கோம். அவங்க ஆன்லைனில் அப்ளை பண்ணலாம். நவம்பர் டிசம்பர் எவ்ரி இயர் அந்த போர்ட்டல் ஓப்பன் ஆகும். அதில் எல்லா ஸ்டூடெண்ட்ஸும் அக்ராஸ் த கண்ட்ரி அவங்க அப்ளை பண்ணலாம். அதை ஷார்ட் லிஸ்ட் பண்ணுறதுக்கு டெலாய்ட்னு ஒரு ஏஜென்சி வச்சுருக்கோம். அவங்க மூலமாக அதை ஷார்ட் லிஸ்ட் பண்ணி டிசர்விங் ஸ்டூடெண்ட்ஸுக்கு இந்த ஸ்காலர்ஷிப் போகுது. இந்த வருஷம் 301 ஸ்டூடெண்ட்ஸுக்கு நம்ம க்ளோஸ் டு 2 crore வரைக்கும் இந்த உதவி தர்றோம். இதை அவங்க ரிசர்ச் கிராண்ட்டுக்கு யூஸ் பண்ணலாம், அவங்க படிப்பு செலவுக்கு யூஸ் பண்ணலாம், அவங்களோட கல்விக்காக இந்த உதவியை பண்ணுறோம். இது தொடர்ந்து 5வது வருடமாக முடிச்சிருக்கு. இது 6வது வருடம் பண்ணுறோம். இது வரைக்கும் 5 வருஷம் பார்த்திங்கன்னா இந்த ஈவெண்ட் மும்பையில் நடக்கும். இது 6வது வருஷம் இங்கே சென்னையில் நடக்கிறது ஒரு பெருமையான விஷயம். ஃபஸ்ட் ஆரம்பிக்கிறப்ப இது வரை 20 ஸ்டூடெண்ட்ஸ்க்கு மட்டும்தான் கொடுக்கப்பட்டுச்சு. 20 லட்ச ரூபா மதிப்புள்ள பணம் தான் பரிமாறப்பட்டுச்சு. இந்த வருஷம் பார்த்திங்கன்னா 301 ஸ்டூடெண்ட்டும் 2 crore ஒர்த் ஆஃப் ஸ்காலர்ஷிப் கொடுக்குறோம். அதே மாதிரி தமிழ்நாட்டில் லிஸ்டர் மெட்ரோபாலிஸ்ங்கிற பேரில் நம்ம 40 வருடமாக இங்கே சர்வீஸ் பண்ணிகிட்டு இருக்கிறோம். ப்ளஸ் ஹைடெக்னு ஒரு டயக்னாஸ்டிக் கம்பெனியை டேக் ஓவர் பண்ணி 2 years ஆச்சு. டோட்டலாக நமக்கு தமிழ்நாட்டில் இப்போ 21 லேபரேட்டரிஸ் இருக்குது. 350 கலெக்ஷன் சென்டர் இருக்குது, 125 ஹோம் கலெக்ஷன் பாய்ஸ் இருக்காங்க. ஸோ இது மூலமாக நம்ம மார்க்கெட்டுக்கு சர்வீஸ் பண்ணிகிட்டு இருக்கிறோம். அண்ட் இது வந்து எங்களோட கமிட்மெண்ட். இந்த சிஎஸ்ஆர் ஆக்டிவிட்டி வந்து நம்ம ஹெல்த் கேர் இண்டஸ்ட்ரிக்கு மெட்ரோபோலிஸ் மூலமாக கொடுக்குற ஒரு கமிட்மெண்ட். அண்ட் தேங்க்யூ வெரி மச்.
Support and nurture the future of healthcare. So, we will continue to, do our bit in giving back to the society and also create a positive impact. So that's largely the bigger agenda behind this program. So, we'll talk in details about it, as we go through the day. But let me thank each one of you for making it possible and attending the event today and part of this, important milestone event in Chennai. I would request each of the friends from the press to take this forward and create a much higher impact about this program in the society, so that the years to come we make this bigger and bigger. Thank you very much, and let me hand it over to Dr. Kirti from here.
It's very interesting, a doctor's journey. It's a very tough journey, as you all know. The brightest minds from various parts of the country appear for an exam and they get through medicine. And they think that now they have achieved, something big. But actually, that's when the problem starts. Because it's a very, very rigorous course. And you are not supported financially in any way. There is no earning. There is a very long incubation period for a doctor. People look at doctors when they are earning in their 40s, 50s, 60s. They do not see the journey of the doctor from 20 to 40. And that is such a difficult part. And especially the 20 to 30 years. And remember, that's the time when your life is growing ahead. You're getting married, you're having children, you're not earning. It becomes very, very difficult. So our chairman, Dr. Sushil Shah, who's also a doctor, one day just came up with an idea that, Kirti, let's give back to medical students, let's give back to the society. But we can't just sit and donate, because that's not the right way. Actually, it should be a merit-based or a need-based scholarship that should be given. So either somebody does not have the funds, does not have the means, or somebody has it, but still he needs a little more to achieve that extra more. And that is where this came about. So for 1 year, we conducted surveys throughout the country, among doctors, among young medical students, among teachers, public, private medical colleges, everywhere. And from there was a common voice that came, that yes, we need some funds, some little funds could help us. Also, we need some research grants. We are not able to publish, we are not able to get good placements in centers of excellence because we have not done good studies. So sometimes, they don't have a million, as our CEO mentioned. They don't know where to go. So they need a lot of nurturing, they need a lot of support. So we created this whole program called MedEngage. And we basically opened our doors to the young medical doctors who nobody is looking out for. And in fact, if you remember, there was also a time when there was a huge uproar and medical students were getting beaten up. Remember, they are the face. Anything goes wrong in the medical system, the patient can only see the doctor. He does not see the whole system behind him. And the doctor suffers. So we reached out to the doctors at a time when everybody was attacking them, and we said, okay, we are here for you, we will hold your hand and we will nurture you till you become, stable on your own. And that's how it started. And as I would like to draw your attention to this board over here, we started in 1819 with only 19 students that we could help, because that time that was the only grant that we got. We started with a very humble budget of 20 lakhs in the first year, and happy to say that from 29 to now 23, it's come to a 2.2 CR budget. Can you imagine the growth of the program from 20 lakhs to 2.2 CR? And 90% of these funds go totally to the beneficiaries. And that is how it has always been. And obviously it went from 30, 40, 122, 250 last year and 301 this year. Then, I always feel that as a company, we always try to synchronize with what is the global wave, the national wave, because there's no point in working in a silo. If everybody gets together and works towards common agendas, it gives better outcomes. So we said, okay, what is our Government of India looking at? So Government of India has very clear narratives going down. They are focusing on Anushandhan, that is innovation. They are focusing on TB Mukt Bharat, which is a big problem plaguing our country. They are focusing on anemia, they are focusing on women, they are focusing on girl child. So we said, why don't we cooperate with the government and do our little best in whatever we can. So we started with Maharashtra, but now, as Sir said, we are focusing on Tamil Nadu. This is a statement that we are making. Tamil Nadu is important for Metropolis, And in whatever way, whether it's diagnostics or whether it's beyond diagnostics, here is where we would like to help more and more medical students. So the program extends for undergraduates for all the 4 years, first year, second year, third year, fourth year, for the internship, again a very critical phase, and for the 3 years of post-graduation. It is not limited to pathology, unlike what people think. All possible clinical fields are supported, whether you are doing medicine, surgery, gynecology, it does not matter. To us, you're just a medical student. So that's how the program goes, and that's how hopefully it will go on with all doctors, under the umbrella of Metropolis.
Medical education course by itself has a lot of expenses involved, be it for the books that we purchase, of the exams that we take up, which happens to be a huge share of the expenses. And also, family where my father passed away due to cancer when I was in class 12, and my mother being the sole breadwinner, it was definitely a tough time to take up my expenses, and I didn't want to depend on someone. So this scholarship has been extremely endearing for quite a few of us, especially those who've been in tough circumstances. And this scholarship being extended to the aspirational districts, I believe, by itself shows the success of the program. And I'm extremely thankful and grateful to the Metropolis team, considering be the chairman, the CEO, and the MD and other members, and the CSR heads as well, or the chief scientific officer for making and the brains behind going the thought process in carving and scripting such scholarship programs. Because even though the CSR funds could be diverted to many other programs, but giving a scholarship program is the most thoughtful thing that someone can do, and I believe that's something extraordinary. And as well, I'm extremely grateful for my mom as well, Mrs. Shanti, and my grandma, Mrs. Jayalakshmi, for carving me to what I am today. So thank you so much for the opportunity.